welcome back to another episode of Surgery 101, the podcast series and app brought to you with the help of the Department of Surgery at the University of Alberta. This week is the second week of a short series of videos showing you some of the work that our surgery team has done in medical education research. Same as last week, we have a short talk that was given at the recent Canadian Conference on Medical Education. Last week we talked about the use of team-based education with undergraduate medical students, and this week we're talking about a slightly different topic, looking at the use of mobile computing devices such as the iPhone in medical education. And it's a study called It's on My iPhone, and it was done with the help of Sean Wallace, who was our summer student in psychology, who has subsequently gone on to enter law school, also Marcia Clark, who's now an orthopaedic surgeon down in the University of Calgary, and myself. So, let's get started. The purpose of the study was to look at how medical teachers and also medical students, learners, were using mobile computing devices such as the iPhone in medical education and practice. It's a fairly basic kind of foundational study, I suppose, looking at how these things are being used at the moment. And if you go back to 1987, this is a picture of me as a medical student, and regular listeners will have seen this picture before. You can see there I am with my textbooks and with my notes and with a human skull there, and that's how I learned when I was a medical student. That's how I got the knowledge and the information needed to become a doctor. If you look at how students are studying today, some of them are still, many of them in fact, are still using textbooks and notes and stuff. But something that's come along since I was a medical student is devices like the iPhone. Devices that can give you constant access to the internet, constant access to information, and let you look stuff up. And really, I think a device like this, had it been available when I was a medical student, would have changed a lot of the ways that I had learned and studied back then. So, given that I'm interested in how medical education is changing over time, it was my idea to do this study looking at how our students currently here in the 2000s are using devices like this. So, we conducted a number of interviews first of all with medical students, residents and faculty as well, and we asked them about how they were currently using these devices in education and in practice, and what they thought about the future use of those devices as well. We'd use a simple thematic approach to summarise the ideas and the concepts which we got in the data, and we then developed an online survey which we sent out to a larger number of people, and we used a classic mixed methods approach to integrate the qualitative and quantitative findings. So what about the results? We interviewed a total of 18 people. 10 of them were medical students, 7 were residents, and there was just the one faculty member interviewed. And then we constructed an online survey and we sent it out, and we got 213 responses, 76 students, 65 residents and 41 faculty members. And if you want more detail about this study, it has been published already. This is in BMJ Open, and again it's called it's on my iPhone. This is BMJ Open. It's an open access journal, and you can get the PDF directly from their website. There's no need to pay for it. So what did we find then? Well, 85% of students reported using a mobile computing device, and I'll focus largely on students and residents in my comments here. Here's resident 02. Their quote was, "In my entire class, everyone has a smartphone. I'm probably one of the last ones to be getting an iPhone." You'll see this is the classic mixed methods approach. We have a number that says 85% of people did a certain thing, and then there's a quotation, which is a qualitative piece of data, which illustrates that point. 55% of students and almost all the residents said they thought mobile computing devices like the iPhone were beneficial to their education. They used devices like this to look stuff up. Almost half of them said they looked up an unfamiliar term on the device at least once a day. Here's a resident 07, who was interviewed, and they said, "I would use it every time I had a new admission, and I would use it on the wards maybe 2 or 3 times a day, especially if I didn't know about a certain drug or I wasn't sure of a dose. They were using it to look stuff up and to check." The residents went on to say that they liked looking stuff up right away. Instead of having to wait until the end of the day and make a list, they were able to look it up right away when they needed the information. Here's another resident saying they used the device to double check things. So if they thought they knew something but they weren't 100% sure, they'd use the device to check it out to make sure they were correct. They're saying they had the leisure of time to look things up, but they didn't really have anybody to ask sometimes. So they ended up asking their device instead. Here's a student talking about looking things up on Wikipedia. They're saying they liked looking things up on Wikipedia because it was quick and it was easy, but they wondered, should they really trust it? Is it something that they would base patient care on? But if it was a more general question like what class of drug is it, a piece of knowledge we're looking for, then maybe it's useful for that. So that's what that student said about Wikipedia. In terms of texting, the majority of learners reported communicating about patients by text. And here's one right in the middle of the interview who gets a text about a patient. This is exactly it here. He gets a text as the phone buzzes. Here's a resident saying that I prefer texting to paging because you can just wait until you get a response. You can ask specific questions by text. You don't have to sit by a phone and wait for 10 minutes till somebody's got the chance to call you back. You can ask an instant question and get a response from the person without having to go through the hassle of a phone call. In terms of the future use of these devices, most of our participants said that they thought that their use was likely to grow, and perhaps no one would be able to cope without a device like this in the future. Here's a student number 7, saying 5 years from now, everybody's probably going to have an iPad with a medical chart on it, so you can stay right up with the current information. So it seemed that the use was widespread and that people liked it. They liked to look things up, and they liked to stay current, and they liked to communicate with it. But what about challenges? Well, we identified 5 challenges in the data. There was superficial learning, quality of information sources, distraction, privacy, and boundary issues. So let's look at those in order. Superficial learning, here's a faculty person saying, in a way you only get bites of things when you look stuff up with your iPhone, and it might be promoting a more superficial knowledge of things as opposed to a more in-depth knowledge. Here's a student kind of saying the same thing. You end up relying upon your device. Rather than having it memorized in your head and having a good differential, use your phone to pull up a list. Here's a resident saying, I use my phone all the time and it's slightly ridiculous how much I use my phone. I never know everything and my phone kind of fills in the gaps for me. In terms of sources, here's a couple of students talking about not knowing what's out there and not knowing what's recommended and not knowing what's good, and they'd like somebody to give them some recommendations on what they can trust. Here's another student saying they don't like using Wikipedia because they're not sure that it's terribly good and terribly reliable for things like treatment. It's good for definitions, but I don't like relying on it for treating actual patients. Our third challenge was distraction. This is a student saying they found it a bit distracting in the classroom because you can use your mobile device to get onto Facebook too easily. And here's another student talking about being distracted when they were on rounds on the ward. They were too busy looking something up, how to spell a drug, and they ended up getting to jot the name of the drug down but didn't get to hear anything else about it because they were distracted using their device. In terms of privacy then, over 50% said that they had used their device to take a picture of a patient at least one time, and about a third of them were concerned about privacy. And here's a resident saying, how much are we going to be communicating patient information with these devices? Lastly then, boundaries. Just over a third said they were worried about this technology compromising professional behaviour because it's not immediately apparent what you're doing on the phone. You're just playing with your phone. Are you texting somebody else, texting your girlfriend or texting your husband about what's for dinner tonight, or are you actually doing work? When other people on the team see you doing these things, they're not quite sure what it is you're doing, and it can be disruptive. Here's the same resident 4, saying perhaps we need to actually divorce the personal device from the private device and have a personal phone just for personal use and a professional device just for work and for patient care. And that professional device would then be kept secure and kept safe, and you wouldn't have to worry about the upkeep of it because it will be a work phone essentially. So in summary then, we think we've shown that at our school this technology has been rapidly adopted by our students and by our teachers to some degree as well, and its use is now widespread. And it's a good thing. It allows rapid access to information, it facilitates communication, and it may actually enhance learning. But some of our findings suggest there's a changing relationship with information. It's only really as good as its source. And we have to think about how we manage information in our lives as learners and as care providers. What about distraction and interruption? What about privacy and boundaries and proper etiquette? It's a good question to ask, is being always on and always available a good thing or not. There was a study a couple of years ago looking at the use of mobile devices in hospital wards and saying that when doctors were more globally connected, they were less locally present, and the nurses they were working with found that it was harder to get hold of them because they were distracted by being connected to the internet. If you want some more information on this, have a look at a book called The Information Diet by Clay Johnson. And his point is that perhaps we need to rethink our relationship with information, maybe not be always on, because it's easy to be overwhelmed by the information that's available to us. In terms of the effect on learning then of these devices, yes, you can get rapid answers to questions that you pose, but I guess we wonder, where does the synthesis and integration step occur? What does it actually mean to know something? And is it the same as being able to look something up really, really fast? Certainly, when I was a medical student, I was very clear on where the location of knowing was. I was going through my textbooks and going through my notes so that I get things organised, put it into a structure, and then get it into my head, and internalise it. So the location of knowing was where the big yellow arrow is there. If you read a book by Nicholas Carr about it's called The Shallows, How the Internet is Changing the Way We Think, or Read, Think and Remember, he talks about us changing from scuba divers to jet skiers. Scuba divers will go down beneath the surface of the information and understand it deeply, whereas jet skiers just stay along the surface and bump along the top of the water. And his book suggests that perhaps the location of knowing is changing. In fact, it's moving from your head and it's going onto your device. And that's a different sort of knowing, that's a different way of learning. And that's really a big change in the way that we teach medical students and that medical students learn. And if you think that's kind of disturbing or kind of interesting, you should think about Google Glass. This is Project Glass, which is coming from Google, which is already being trialled in various places around the world. I saw a demo of it recently where somebody looked something up in real time and they asked a question and got the information back on the glass inside a second. And the person who was doing the demonstration said, it's coming back to you so quickly, the answer to your question, it's the same as knowing it essentially. And if that's true, then the location of knowing is changing already, and it's going to change more as we go further down this road with new technology. It is a small study that we did. It's just at the one site. We have a fairly small number of people who responded compared to the large number of learners that we have, and I think there is a possible response bias. Obviously, people who don't have the technology wouldn't answer a survey about it, so it may just be early adopters we're talking to. We do think that our experiences are consistent with our findings in this study. Certainly we see examples of this every single day in practice, and we think that the use of these devices is widespread in clinical environments. It's very normal to see students looking at their phones all the time in the clinic, and it's very normal to see residents in the OR working with their phones in between cases. So in conclusion then, we think this new technology offers the potential to enhance learning, but also some potential challenges and problems associated with its use. And we think it's important for the leadership of medical schools and healthcare organisations to set the agenda in this rapidly developing area to try and maximise the benefits of this powerful new technology while avoiding unintended consequences. We'd like to thank the University of Alberta Faculty of Medicine and Dentistry Summer Studentships for their funding for Sean Wallace, and we'd also like to thank Shannon Erickson for her help with this project. That's it for this week's episode of Surgery 101. We hope you've enjoyed this little talk from our visit to CCME. Please let us know what you think. Send us an email at surgerypodcast@gmail.com. Check us out on Facebook or send us a tweet on Twitter at surgery_101. Also, please visit us at our website, surgery101.org. Thanks for listening, and we'll see you back here next week on Surgery 101.